welcome back to the channel. This is Not a Real Doctor, DPT, and my name is Eric. I am a licensed and practicing doctor of physical therapy, and today's topic is going to be the basics of the field of physical therapy. This is part one in a 5-part series, and in today's video, we're going to address what is physical therapy. And I thought it would be best to start with looking at the definitions of physical therapy. And what do you find if a person doesn't know what physical therapy is and they go and search out on the internet? What would they find? So let's look at some things you can see for that. So I went to Yahoo Dictionary just as a start, just to see, okay, what do they say that physical therapy actually is? So let's read this here. It says, physical therapy is the treatment of disease, injury, or deformity by physical methods such as massage, heat treatment, and exercise rather than by drugs or surgery. Yes, is that partly what physical therapy entails? Yeah, it is, but it's not anywhere close to really what physical therapy is and can do. It definitely downplays what physical therapy actually is. So I also wanted to look at Wikipedia, since it's used so much by people to look up things that they don't know. And I just typed in, what is physical therapy? And it pulls up in the Wikipedia page, the physical therapy page here that I'm showing. So it says physical therapy, also known as physiotherapy, which it is around the world, is one of the allied health professions. It's provided by physical therapists. So right off the bat, if you're someone who doesn't know what physical therapy is and you type in Wikipedia and say, what is physical therapy? In the definition of physical therapy and how they're talking about it, it actually uses the word physical therapy. Like, you can't do that if you're defining that. So I would go through this and I would look at this if I didn't know anything about physical therapy. And I mean, yes, it does get me into some specialty areas, and I kind of go through here. It does give me an overview here. Let's see. This says physical therapy addresses the illnesses or injuries that limit a person's abilities to move. All right, now we're moving in a better direction, and perform functional activities in their daily lives. PTs use individuals' history and physical examination to arrive at a diagnosis and establish a management plan. So this is pretty good as they get into the overview, but you have to get down kind of into it, and perhaps someone would, but that is still not my favorite. I'm going to come over here to, let's go to, I believe it was it was the Mayo Clinic that had a good definition of this, and that we're going to work from. So, according to the Mayo Clinic, as we pull up here just on this definition of what is physical therapy, this says physical therapists work with people who have experienced an injury or disease that has affected their movement and range of motion. Now we're starting to get into it a little bit more. A physical therapist will examine. I like that definition from the Mayo Clinic really the best because it mentions movement. As to why that's important, we can go back to really the history of physical therapy. As you saw on that Wikipedia page, physical therapy really has a long history. We've known for thousands of years that if you move a joint, you can do manual therapy. If you move around a little bit, you can help to feel better. Where that really came to prominence in the modern era was in World War I. And that was when they noticed in the military that soldiers who were wounded, who when they went back to the hospital and received extra care from nursing related to helping them to walk more, helping them to get out of bed more, those soldiers tended to heal a little better, they tended to recover a little quicker, and they returned to the battle faster. So it was from that physical therapy in the United States was really born and created. And that hits at what the Mayo Clinic was talking about. And the critical thing in all that is movement. Physical therapist and what physical therapy addresses are issues that movement can help with. So we're not going to be able to work on every single condition out there, but if you are having difficulty with moving joints on a smaller level, say I can't move my knee very well without having pain. I can't move my shoulder well, my elbow. So that's kind of all related to one specific joint and having difficulty with movement of that, all the way up to the larger level, which is I actually have difficulty getting out of a chair. I have difficulty walking across a room. I have frequent falls when I do move. All of that continuum from kind of that smaller level specifically to the joint all the way up to that larger level where we're talking all of your joints working together. Those are all things that are addressed with physical therapy. So to circle back around, the best definition that I've found for what physical therapy is came from one of my clinical instructors when I was working on my doctorate. And what he would tell his patients and what I have since been telling mine is physical therapy is the art and science of putting your body into the best position so that it can heal itself. We do that through a couple of different tools that we have in the toolbox of physical therapy. Research has shown us that number one, we have exercise. We can do tons of different exercises out there to address a variety of different conditions to help get your body stronger so that it can move better. But we can also do that with manual therapy. And actually, those are really the two tools that have the most bearing for physical therapy. I would say they're utilized the most. Research supports them the most. Different manual therapies, I'll do an entire video on series on that more than likely in the future. But manual therapy is where we are helping to passively move a joint, because sometimes just to move it actively is not enough. Sometimes that joint needs to actually be moved passively so that you can break through adhesions, so that you can just help things move and slide better within the joint itself. And then actively, that muscle can then move it in a better fashion. So I think that's the best definition that have come across and found was from my clinical instructor regarding what is physical therapy. The short of all of this would simply be, for physical therapy, who are physical therapy, or well, that's a later video. For what is physical therapy, physical therapy is to help you move better. It's to help patients who have dysfunctions in movement. That's who physical therapists are. We are the movement people. If you have any pain or dysfunction when you move, your first thought needs to be, I need to go to a physical therapist. Now, there is an adjunct to that, which would be simply, there are some things that you should better treat with a real doctor. Physical therapy is not going to help all conditions. If you have a fracture, physical therapy is not going to help with that. You need a real doctor for that. If you have some condition within, you have a liver condition, physical therapy is not going to help with that. So there are those medical conditions out there that require real doctors. But if you have difficulty moving, then you need to be thinking of going to a doctor of physical therapy. That is who can help you. So thank you for tuning in for this video. I hope that it has helped to bring a little bit of education to you about what is physical therapy and why you would seek a physical therapist. My next video is going to be on why you would seek a physical therapist and versus a medical physician. So physical therapy, as I say, is not going to help with everything, but there's some things that that we can help with, and that's what my why would a person seek physical therapy video is going to be related to. So thank you for tuning in. If this has helped you at all, then please subscribe.